We use measures of other things like quality of life or functioning. And so I frequently do this with a lot of the clients I work with. And there's one measure of quality of life and recovery that I love. And it includes domains like doing things important to the client or positive experiences like happiness. And what I love is that when we explore items and concepts like these, discussing and exploring the measures and the client's responses, that's part of measurement based care. We have the opportunity to learn about intrinsic and values based aspects of clients' lives. So, this not only allows us to validate and affirm the person, but it really just aligns beautifully with a strengths based and motivational interviewing style or approach. And that's obviously something that we know is really helpful in SUD care. And so, of course, the SUD specific outcomes are important, but there's just so much to every person we work with. And when we use recovery, quality of life, or these other kinds of measures, we can better support clients by tapping into these aspects of their lives. And then we can leverage what we learn, we can leverage that exploration to actually help their treatment. And then we also have an opportunity to balance some of these more SUD specific types of conversations that we know can feel difficult. They can sometimes feel stigmatizing, but we can balance those with conversations that are empowering and holistic.